Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. So we are going to look into the parenteral nutrition. So here the nutrition is administered via the IV route, and there are two delivery routes, that is it can be the parenteral as well as it can be the central. So here in the peripheral parenteral nutrition, it can be used for the short term nutrition. So this is short term, that is up to 2 weeks. The advantage is to avoid complications of the central venous administration. So you avoid these complications, and disadvantage is it is limited to the development of the thrombophlebitis. So it is limited to the development of the thrombophlebitis. So total parenteral nutrition. So this TPN, there is a central vein preferred. So central veins are preferred. So what is the order? The order is, first it includes the subclavian, next it includes the internal jugular, then it includes the femoral. Now in traumatic patients, there is the IJ, that is internal jugular is preferred. So internal jugular is what is preferred in case of the trauma patients. Then when you look at the infraclavicular, so infraclavicular subclavian approach. So this approach is for the subclavian vein. Then the long-term TPN is often delivered via the Hickman lines. So the longer is by the Hickman line. Now let's look into the TPN formation. So the formation, it includes the solution with the lipid. So with lipid and without lipid. So let's look at with lipid. So the solutions with the lipid, that is, it includes 3 in 1. So it is 3 in 1. So by the ratio it is 60:20:20. So here, so 60 it refers to the dextrose, and 20 here it refers to the amino acid, and other 20 is by nothing but the fat. So the calories of the dextrose is about 55 to 60. So dextrose, it amounts to about 55 to 60. Next is the calories of the amino acid. The amino acid is going to be 20 to 25. Then comes the calorie from fat. The fat is going to be about 20%. Next, so when we talk about the three components, is the dextrose, amino acid and the fat, so DAF. So next we go on to the without the lipid. So it is without lipid. So without lipid, what is present? So without lipid, it is nothing but 2 in 1, 75 and 25. So this is nothing but by dextrose and the amino acids. So with lipid means there was fat, here there is no fat. So no lipids are used. Then let's look at some complications of the TPN. The complication is that it is related to the nutrition deficiency. It is related to the nutrition deficiency, and it includes the hypoglycemia. So there is hypoglycemia, hypophosphatemia, as well as a hypocalcemia. So hypoglycemia, hypophosphatemia, hypocalcemia, as well as the hypomagnesemia. The chronic deficiency syndrome, it can occur along with the TPN, and it leads to deficiencies in essential fatty acids. So this chronic deficiency syndrome, it can occur in long-term TPN. So it can lead to deficiencies of the fatty acids, zinc, trace minerals as well as the vitamins. So what are the complications of overfeeding? The overfeeding of glucose, it can lead to the hyperglycemia, hyperosmolar dehydration, the hepatic steatosis, the hypercapnia, as well as it can lead to hypercapnia, fluid retention, as well as the erythrolytemia. Next is the overfeeding of fatty acids, OF of fatty acids. So what is meant by the overfeeding of fatty acids? It includes a hypercholesterolemia. So it is a hypercholesterolemia. Then comes the hypertriglyceridemia, Next is increased risk of the hypersensitivity reactions. So overfeeding of amino acids, it can lead to the hypochloric metabolic acidosis, the hypercalcemia, as well as the uremia. The complication related to the sepsis, that is the catheter related sepsis. The most common complication of the central venous catheterization. So there can be sepsis. That increased risk of the systemic sepsis. Now what are the complications? The complications related to the CVC insertion is there are two, that there can be at the time of insertion as well as at the time of insertion. So during insertion there can be presence of, there can be pneumothorax. It can lead to pneumothorax, the most dangerous complication. Then comes the injury to the adjacent artery, the air embolism, as well as the thoracic duct injury, the perforation, the cardiac tamponade, as well as the pleural effusion. Now after long-term use, what is present? So after the long-term use, it can lead to the occlusion as well as the venous thrombosis. To learn and grow daily like this, please do subscribe.